So first of all, let's start off at the basics. If some of you might know about social care, some of you might not know at all. So I'm just starting right at the beginning. So what is social care? So social care is used as an umbrella term to cover a whole range of people, settings, needs and wants, really. So it reaches people across their lifespan, so from babies right to the very elderly in society, and in a range of different settings, incorporating all four fields of nursing practice. So whether you've come on to joined us today and you're an adult nurse, a mental health nurse, learning disabilities, or a children's nurse even, there probably is roles within social care that would be available for you moving forwards, hopefully. So it is really a broad spectrum. And why does it matter? Well, social care concerns all of us because at some point in our lives, we will all be likely to draw to support somebody we care about or to draw on that care ourselves. So somewhere throughout our personal lives, we will be involved within social care. And so it really matters to all of us. So social care, I think, is absolutely, it's a selection of different areas. It's really broad, but it's really a way of working. So it's about working within a model of care which seeks to remove unnecessary barriers which prevent people participating in society and accessing work and living independently. So it's a model of care, and that model of care asks what can be done to remove the barriers to inclusion. So it's really about including everybody and trying to get everybody to live independently and be included within society. Social care nurses and nursing associates work within this model, and they are involved in hugely important work, and it's really aimed at supporting individuals live the life that they want to live. Person-centered care, you would have heard about this throughout your nurse training, but I think in social care, it really comes to the forefront more than anywhere else. So it's absolutely key in social care. So I just wanted to touch on this. Just a little reminder. You will all know this, I'm sure, but let's just really, focus in on this because it's so important. So person-centered care is an approach in health and social care that focuses on the individual's needs, preferences, values, and personal goals, ensuring that they are actively involved in the decisions about their care. So it's really all about that individual. What can you do as a nurse to advocate for, to support, to be there, to improve the health of, and to help this individual become more inclusive within society? So just on a very practical level, if you worked in social care, where would you go? So domiciliary care, that basically means working out in the community. So domiciliary is going to people's homes. So there's a lot of domiciliary care agencies now that might have a nurse as managing them, but have a lot of carers going out to people's homes. The model is expected to evolve as more and more complex needs are catered for within people's individual homes. The level of care is going to increase and the level of nursing care is going to increase. So we're going to see a lot more roles of people going out into individuals' homes to support them with nursing care within their homes. So there might be jobs doing that. There might be jobs, and I think this is where people think about that, working in a registered care home. So this could be nursing homes. You might be thinking about nursing homes for older people, and that could well be somewhere to work. However, there's a lot of different types of nursing homes. There's nursing homes that cater for people with complex medical conditions, for mental health problems, with learning disabilities, for dementia, or for end of life. So there's very different types of homes that you could potentially be working in. There's daycare centres, maybe for people with long and enduring mental health concerns or with addictions or with learning disabilities. So a range of those. There's even farms. We've had some students go out to some care farms where nurses are working, and within the charity sector as well. So it's really broad, basically. It's really broad. And within there, yes, you might start in maybe a junior role as a nurse, but there's a whole lot of places where you could go after that. So you could move up to clinical nurse specialist, you could move up to being a registered manager or a deputy manager of a home. You could be a daycare centre leader. You could be a farmer. Like I said, we know some nurse farmers out there supporting people on their care farm. You could go into research. We are hearing, I had a conversation the other day with a creative health lead. So we're seeing a lot more around creative health being used in nursing and other interventions to support people. Or you could go into more of a office-based role, looking at quality assurance, governance, compliance, auditing, that type of thing. I would encourage you in terms of kind of documents to look at. This Skills for Care helped develop this document, the Care Workforce Pathway for Adult Social Care. And this really gives a structure to the careers within social care, and it looks at what values you need and what skills you need and what cares are, what roles are out there. So lots more detail in that document there. So let's just have a little look at some of the statistics. At the moment, and I think this is a little bit hidden. I think, you know, you might know this. I don't know. I think certainly when I did my training, it's a little bit hidden that all this work goes on within social care. So in England alone, there's 1.7 million people who work in social care, which is a lot. And in terms of who provides this social care, there's lots of different providers, 20,000 different social care providers. And that could be those nursing homes we talked about, care homes, domiciliary care agencies. So lots of different places and employers that are potentially out there for you. 10 million people annually draw on care and support from social care providers. And we'll talk more about the population need for social care in a moment. So let's just think about the east of England. 200,000 people work in adult social care just in the east of England. And within that, there are lots of different roles. Thinking about nursing roles, so these aren't nursing associates, just nurses. 3,000 nurses work in adult social care in the east of England. So there's a lot of people who are working in social care who have done their nursing qualifications and gone in, or maybe not gone directly, but are working in social care at the moment. And there we'll see AHP roles as well. So 425 occupational therapists working across the east of England. And there's also physiotherapists and nursing associates as well are being championed by some care providers and are providing really valuable care within the health and social in the social care setting as well. So I'm going to just take some time now. Like I said, we with Skills for Care and Helen's help, we identified some nurses who were working in social care, and we just asked them about it and what it meant to them. And I wanted you to just hear from them because I think it's quite inspirational. So I'm hoping the sound works. If the sound doesn't work, please do shout out and let me know. So let's see if we
First
can.
of all, I would like to say whatever I say is based on entirely my experience. Because as I said earlier, I come from a entirely different background in terms of upbringing and also the professionalism. So I know I had the skills, I was trained for it, but I lacked the confidence because of the background and the upbringing. But because I had really great management support uh, and the preceptorship, because of that, only and only because of that, I was supported to gain my confidence on my skills. And that made me feel confident in terms of my job, which made a great impact. So when I started having my confidence in on my skills, I realized the job that you do in social care is not just being a nurse. When you are a nurse, you know the residents, you know your residents' histories, their wishes, what they would like, how they would like to be supported, and what they fear. So that gives you a clear perspective of how to advocate for your resident. And that gives you enough confidence and compassion to advocate for your residents based on their wishes and based on their fears. So as you grow, you realize something that is really important. In social care, you lead. Your decisions shape the shift. Your judgment basically makes a guideline for your teammates, and they really look upon you based on the decisions that you make for the resident that you look after based on their wishes. So,
So Hepsi there mentioned around preceptorship, and I just wanted to draw your attention to that. So you will know about preceptorship. Hopefully you'll know about preceptorship. It's recommended by the NMC that after you qualify, you will have a period of like supported practice through a preceptorship program. So the National Preceptorship Framework was developed, and this will be influencing the preceptorships that many of you would be offered if you went into a hospital or in a community team. You'll be offered a preceptorship course that followed the framework principles. Delighted to say that Skills for Care, who, like Helen said, oversees social care, have adopted these national preceptorship framework. And so many of the organisations now adhere to these and will run a similar preceptorship, really well supported preceptorship for those newly qualified nurses and nursing associates who are entering social care. So I think that's really made a difference. I think certainly there you could hear it's made a difference when you're supported right at the beginning. We know it makes a difference statistically to whether you're likely to stay, your enjoyment of the role. So I just wanted to point that out. I also want to point out another important document, which is the workforce strategy, which Skills for Care again has helped develop, which gives you lots of information around the needs and the likely increase in workforce that's going to be required within social care as well. So the support is out there, and certainly if you do find a role that you're interested in, do ask questions around the preceptorship program as well. Okay, so here's Helen, who we recorded earlier.
Thank you. So I kind of wanted to talk a little bit more focus on kind of the leadership opportunities in social care, because that's something that I've had the opportunity to kind of develop in. And I think it's being able to share that there is the opportunity to work in a really diverse range of roles in social care. And we need dynamic, challenging individuals to come in, and that there is the opportunity to have a really rewarding career in social care. These roles that I've had the opportunity to kind of undertake, they've supported me to be able to develop a motivational and a very compassionate leadership style, using the skills that I've developed to be able to work with a range of stakeholders to unite them and really shape services for the better, which brings a huge amount of job satisfaction as a person, being able to look at what the issues are, bring people.
Okay, and we're going to hear more from Helen, and I'm delighted to say later on. Just before we hear more from Charlene as well and some other social care nurses, I just wanted to show you this slide about the facts. Now, this is facts around the population. So why do we need that social care nursing? We talked around some of the organisations before, but actually when we look at our population, we can see that we're going to need people, we're going to need fantastic nurses like yourselves to come and work into social care. So the number of people aged 65 and above is set to increase from 10.5 million to 13.8 million by 2035. So that's an increase by around 32%. So yeah, well, I'll carry on reading. So the number of people with dementia is expected to rise by 43% by 2040. So 1.4 million people are expected to have dementia by 2040. The number of people, younger people under 64 with a learning disability, mental health need or physical disability is also projected to increase over this period. And then looking at the health long-term conditions of people, of older people, of a person by the time they reach the age of 75, they are 60% more likely to possess 2 or more significant conditions, and that increases to 75% for those between the ages of 85 and 89 years old. So this is from Skills for Care. Thank you very much to Skills for Care for the information on some of these slides. Their projections show that if the number of adult social care posts grows proportionately to the number of people who need this, they're expecting their workforce to grow by 29%. So that's 5,400 extra new posts will be required by 2040. So I just wanted to share that to say, give you some idea of the sort of population health, what we're expecting for the future. But also that's an opportunity. That's an opportunity for you guys to think about working differently, maybe coming into social care. Alongside this, you will all be aware that we've recently had the 10-year plan come out, and one of the key components of that and one of the key drivers within that is around the move from hospitals to community. So supporting people within that neighbourhood setting, and that's where social care really comes in as well. So I think we're going to see a lot more jobs in the neighbourhood, in the communities, in the social care setting. So we're going to, this is just about, I think about a 6-minute film that just gives you more information and gives you a feel of really what it's like to be working in social care.
My journey into nursing and social care started as a student nurse, and I actually did a placement here at Homewood House as a student nurse. And I think from that I kind of got my love of nursing and social care.
Always knew I wanted to be a nurse, so as soon as I finished school I got my first job in the kitchen of a residential home. Absolutely fell in love with the role, so done that for a number of years until I got my nurse's qualification.
I love it, it's brilliant. You make such a difference to people's lives. It's true, for me it's true holistic practice. You get to spend quality time with people, it's not a rush in, rush out, and you get to see a variety of clinical experiences, lots of clinical needs, lots of different age groups. You get to act as a resource for the multidisciplinary team. We do everything. You're a little star, aren't you? Making sure everything's clean.
There is a perception that it can be very much where you go towards the end of your career. It's a lot more than that. So for me personally, I've been a nurse for 3 years. I worked in the nursing home for a year before progressing to the deputy manager clinical lead role. Within my own company, the senior leaders are all nurses themselves, so there's opportunities to go all the way from making decisions on the floor to making really complex decisions about the provision of care and funding.
I think the level of skills that you have to have, I think the level of autonomy, I think people underestimate social care.
It's about having the clinical skills to do gastrostomy care, ventilation, tracheostomies, seizure management, advanced medication management.
There's a lot of communication skills. That's being able to communicate differently with the residents, the staff, their families. The technique that you use when talking to people is different depending on who you're talking to, especially in difficult situations. So if you're looking after someone towards the end of their life and are having to have challenging and often upsetting conversations with relatives, you need to use those skills.
If you're the nurse in charge, then you are kind of in charge of those residents. You are looking at kind of their care needs for the day. You're managing the staff, liaising with lots of the MDT team. And just, I think it's a large role, and it changes every day. So it could be that you're joining in with the activities and having a bit of fun, but you're also doing some wound care.
Yeah, you are basically responsible for a group of people. You don't have the backup that nurses would have in the acute sector on a ward. So you have to sort of know your residents very well, and you need to know how to escalate care appropriately.
It's a total different role than a hospital nurse, because you need to know legislation and you have to have people skills. People who are coming and interacting with you, you will see them for a long period of time. It's not only for a short period like in hospital, when you have that active clinical concern. Here is a journey. You create connection, you create bonds, and you have a relation with your clients.
It can definitely be challenging sometimes with the isolation. You don't often have specialists that you can pull on instantly like you would in other roles, but I think having the autonomy and the confidence to make your own decisions and really lead the delivery of care is what makes the challenging aspects actually also enjoyable.
The end of life part of it can be very challenging.
You know, everybody has emotions, so you can't help but to feel, you know, sadness when somebody passes away.
The best part is the interaction with the residents and the families. So you get to, I don't think you can kind of put a price on the smiles that you kind of get each day, so they're always laughing. When you come in and they get to know you by name and a little bit about you and your family, and you get to know them.
So healthcare is very much fixing a problem that someone may have. Social care is looking at the whole person. So yes, we are dealing with them when they're unwell, fixing any issues, but being able to sit in my office and do my role and hear the laughter and the fun of the residents doing the activities and having a good time, making their life as fulfilling as you can, often in that last chapter of their life, is what I enjoy most.
I enjoy the variety, the making a difference, and people tell me off, but I like to be the fourth emergency service. So I'm someone that they can come to for help and guidance and support, so they don't feel that they're alone.
You really get to know them as a person and what they did, get to know their families, and you really get to see the people behind their medical conditions and the health needs.
I think the difference between when you're working on kind of a ward in the hospital is very much kind of bay one, bed one. It's not kind of who the resident is in that specific room and you know them by the name. And a massive part of it is they are here, some of them obviously elderly, and they are coming for kind of that company, but also maybe for that end of life care. And so the end of life care, you know, making sure that they've got everything that they need and they have their dignity maintained and we have everything in place, and being there with them and their family. I don't think, you know, that's you can't put a price on it really. It's one of my favourite things, I think.
Okay, thanks very much to Charlene for taking part in that film, and the other nurses there as well. So now I just want to give you some time really for the students who are on the call, just to take a moment and reflect. Who is the nurse you want to be? What sort of nurse do you want to be? We heard a lot there around that, seeing the whole person, building relationships, getting to know the family, getting to know the person. Do you want to contribute to that type of nursing in the future? And what is the care that you want to give? Just have a little time to think about that. And just to sort of help structure your thoughts in terms of what we're talking about today. So some questions to ask yourself. Do you want to be able to provide strengths-based collaborative care? Do you want to work with individuals and their wider circle of contacts with their families, friends and carers? Do you want to be able to get to know the individuals who you're working with over a medium to longer term and build those relationships? Do you want to shape the quality of care for a person within or close to their own home? Do you want to be able to enjoy high levels of autonomy? Do you want to be able to manage complex, multiple long-term conditions? And do you want to have the opportunity to progress your career into potentially like leadership and really high level leadership or advanced practice roles? And if so, if you're thinking, yeah, do you know what, that sounds good, social care nursing may be for you. So if you are thinking, yeah, I'm really interested, and hopefully, you know, from just your presence here today and from what you've heard so far, you are interested, what are the next steps? So how do you find a job? We can share these, but there is a Padlet that NHS East of England team have put together. And this has lots of different companies. We talked before about 20,000 different employers out there, potentially. They're not all on the Padlet, but some of them are. NHS jobs just usually has NHS jobs on there. However, you will see some, I have seen some care home jobs on there as well. And so do look on NHS jobs. I know Barchester, which is one of the big care home companies, advertise on there, but not many care homes or social care employers do. However, on the Padlet, there's especially local employers and lots of contacts there. But you know what I'm going to say to you guys today? You are really valuable. The skills that you have gained and worked on over these last 3 years or 2 years, depending on what role you're fulfilling, they're really valuable. They're going to be really useful to somebody in the future. So just take a moment and feel proud of for yourself for that, and recognize your own strengths. And I would say find your own role. So in terms of because you might be coming to this with other things going on in your life. You know, you might have a child at home that you have to look after on a Monday and Thursday, and then, you know, some other times you need some flexibility. Or you might have, you know, somebody else that you're caring for. You might just for whatever reason want particular hours or something like that, or you might not be able to travel far. Whatever it is, I would say stop and think about that. Think about what you can offer somebody else, and then look within your local area what homes are out there, what organisations are out there, what domiciliary care agencies are out there, and maybe just approach them. Just say, look, I've got all this to offer. I can do all this. I really, you know, if you want to offer that person-centred care, if you have those values, shout about it, tell people about it. And I know that enthusiasm goes an awful long way as an employer and somebody who's, you know, interviewed other people. If I'm hearing that, if I'm seeing that from people, you want them to be part of your team. So don't be afraid of shouting about who you are, knowing your value, and going out and approaching people and telling them about it. So there are ways, there are sites out there, but if not, I would say identify organizations out there, research them, and see if you want to go and work with them, and then just go and talk to them. Okay, so thanks very much to Helen for some of the comments on here. There is a help sheet which you will find on the Student Learner Toolkit app, which says more in detail about this. But thinking about the interview questions that you're likely to be asked, you know, make sure you've done some research about the company you're going for, because they might ask you questions about why do you want to join this company, and you can make it sound really real towards that company. Think about what's attracted you to the position, and we've talked about what does a nurse mean to you. You absolutely want to talk about person-centered care in your interview. There might be some questions around legislation around the Mental Capacity Act, around NMC code, around the 5 CQC domains. So just do some research around those if you don't know them already. Think about escalation processes and think about some scenarios. You know, what would you do if this happened? And if you're not sure about all this, in fact, I would say it's a positive thing. But if you see a job advertised, go to that organisation and just say, I'm really interested in this. I'd just like to know a little bit more. Could you tell me what would happen in this situation, that situation? It shows you're interested, and then you'll be better prepared for the interview as well. Absolutely have some scenarios, practice that. Even if you haven't worked in social care, think about something you've done somewhere else you've done when you've been on a placement that you could bring, that you could talk about, that reflects the scenarios that might be happening in that social care organisation you're going to. There will be probably questions about safeguarding, about challenging situations, about record keeping, maybe infection prevention control, maybe about care planning. So there's more information on that on the Learn Toolkit. Thanks very much, Helen, for preparing those. And now I am going to hand over to, I don't know if any of my colleagues, before we go on to questions, wants to come in and add anything else. Please do raise your hands, just come in and talk now. Yeah, Helen, please do come in.
I was just going to say, I think you've covered that really, really well, Amanda, about the different roles that are out there and how to potentially go and find out about them. And I think it's really important that if you haven't had that opportunity to have that experience in a social care setting, either before you started your nurse training or during your training, that actually you really do recognise, and like Amanda advised, shout about those really transferable skills, because actually I might not have worked in these settings, but I have developed these skills and they would support me within a social care setting as well, just to feel confident in going for those roles. That's anything that I would really add.
Thanks very much, Helen. Thanks. Okay, so actually I'm going to stop sharing because I've got no more slides. Stop presenting. There we go. Okay. So I'm just looking through the chat. Thank you very much for the comments in the chat. Thanks, Sue, as well, for adding the comments there. I'm just thinking, yeah, how are you feeling now? Sue has asked in the chat, and we really want to hear from you guys as well. So is there anything, any burning, or any questions at all? And no question is a silly question, because, you know, this is the time to ask about what you might want to do next, or just anything that you're thinking about, or any reflections or anything that's changed for you, you know, thinking about social care. Please do raise your hands. I'm going to stop. Oh, yes. Lola, please do come in.
Hi, good afternoon, everyone. So well, thank you very much for putting this on, because it's always good to have something like this, especially for someone who's just about to come out. I've got my final placement happening in the next few weeks. And I think it's a bit concerning, and when it is you hear of students who've just left and they're in the process of still finding jobs, and that's not everyone's case, but it just puts us on not a negative footing, it's an uncertainty, I should say, about the climate more than anything else. And it's just like, what do we do to prepare ourselves? So, as I said, something like this is really good to have, but it still makes me, well, I should say, anxious about what do I do next? You know, I don't want to say that I was sold a false promise. That is not true. I mean, every time I go on placement, I'm happy that I believe this is where I want to be. I know this is what I want to do more than anything else. I've come out of one career, all right, which I was happy with, and this transition has really served me in good stead. But am I going to be given an opportunity, or am I going to get that opportunity to use it, is my concern. I've taken the deep dive, and I went and applied for a post, I think it was community I saw. So I said, okay, why not? Let me just try it. And okay, it's disheartening when it is you're told no. But then I want to know, well, then what do I do next? You know, because there are no positions out there. So I mean, are you saying that I should just go into social or look? And yes, I understand look, but am I asking the right question? Yeah.
Nola, thank you so much for that. And first of all, before I just come to Helen, I want to say, first of all, thanks for your bravery for asking the question, because I'm sure you won't be the only one who's sitting there thinking and feeling those anxieties, and it's completely normal to feel that. And I just want to talk to the point that you mentioned around, you know, you said you weren't sold a false promise, but actually I think there was, and I think we can acknowledge this, there is an expectation that if you do a nursing course or a health course, certainly 3 years ago, that you would get a job. And it was a bit of a kind of assumption, you know, I'm going to get a job, it's a safe career. And I think, you know, that's the sort of mindset that I think we all had, and certainly, you know, for your generation, you all had. And so I think it is a bit of a shock now at this stage where there's not as many jobs available. And I think that's a difficult situation to be in. And I think it is worth just allowing yourself to think, actually, this isn't normal. I should, you know, anxiety around this is a normal reaction to something that is an abnormal situation, really, that we weren't expecting at all. So, you know, be kind to yourself around that. And so now I'm going to come to Helen because I know that you had your hand up to answer the question. Thank you.
Yeah, I was just going to kind of add to that about it's easier said than done, isn't it? But not being disheartened or put off. You're doing that right thing by looking at jobs that are out there and applying for them, and maybe recognising that social care is an area that might offer you some support, and kind of leading back to what Sue said earlier. Potentially you might have an idea of where you want to work, but actually if that first choice isn't there, it might be worth looking at other opportunities. So not narrowing it down to a hospital, but considering those in primary care, in community care, and in social care, and really kind of having that strong understanding of how those skills, those really strong skills that you have as a student nurse and what you develop through your training would support you in each of those. But not being too disheartened if actually that isn't the right role for you and you aren't chosen for that role. It's really important that the organisation that you go to work for is one that recognises the value of newly qualified nurses and actually will put that support in place for you as well, because actually if they don't want to invest in you, that probably wasn't the right organisation for you. I mean, it also might be there's a lot of competition, but we do know that there are vacancies across adult social care in every region in the Eastern region. So we know that there are roles that are there as well. So if that's something you wanted to consider, something that I've offered to other students is almost having kind of one-to-one support with them, where they've just set up a Teams call with me and we've just gone through a little bit more, any questions that somebody might have had, or just that little bit greater understanding of it. And I'm always very happy to do that as well. If you don't have that experience in social care and you really want to understand it a little bit more, and is this what I want to do? Do I want to look at roles that are out there? Because it's a big choice to make, isn't it?
Thanks so much, Helen. Charlene, would you like to come in now, please?
Yeah, I was just going to add that I think how you're feeling is normal. 20 years ago, when I kind of did mine, it was the same. I think I automatically, and the same with everybody that I trained with, had that not like assumption that we'd get a job, but it was a similar kind of thing. When we came to kind of qualifying, there weren't any kind of jobs within the hospital as such. And so we were kind of like a bit left and kind of had to kind of look for what we were kind of ourselves and kind of different areas. And I think just have a look kind of in your local area, and go to kind of the different places. So not necessarily, you know, it doesn't always have to be a nursing home. There are, like we discussed, you know, homes that specialise in different areas, and just go in and have a chat with them. You know, I love it when we kind of get people come to the door and have a chat with me, or they're looking for a job. We always make them welcome. We'll give advice, we'll have a chat. If we don't have anything at the time, I'm always happy to take your name, your details, and we'll kind of always contact you if we've got something coming up. But I know there are lots of homes that are looking for those newly qualified nurses with those new skills, who we're happy to kind of, you know, help grow and gain extra skills. So always, you know, ring up those kind of homes and different places in the community. We might not always be advertising on your kind of your NHS places, but you know, Indeed and those other kind of places, there are a lot of kind of homes that advertise on there. So always have a look. Yeah.
Thank you so much for your input. All right. I mean, it's good to hear that that support is there. I'm going to be taking names and emails, because I'm going to contact everyone at some point. But yeah, it's good to know that as I said, something like this is on. I'm surprised a lot of my other cohorts haven't had the time to actually register for it, but I saw it in an email. I said, you know what, I'm just going to register it. It doesn't hurt to attend and to learn what's out there. With my placements, I haven't had any experience in the only primary care setting or out community was in a GP surgery. So I don't really know what the practices are like in the nursing homes or in any other setting, but it's good to know and to find out. So thank you.
Thanks very much for your question, Ella. I think it's a really pertinent question and really relevant to lots of people on the call. And thanks very much to Charlene and Helen for the answers there as well. Helen, thanks as well. You've just put your contact details in the chat there. I know that your advice and support is really, really valued. So thanks for that. Please do have a look at the chat and take down Helen's contact details there if anybody's interested. Are there any other questions? Any other thoughts or just reflections, or just, you know, if you want to share how you're feeling? Okay, I'm just going to Sorry, reading the chat. My question: what is the process for applying for a job? Hospitals, NHS Trust, and when do I start applying? Okay, for that, Safi, I would contact a practice education facilitator within the trust because I don't have the answers to that over here. So I think that's probably if you've had a placement there, or you could look on their vacancy pages, or speak to somebody if you're, I don't know which university you're at, but if your university has placements with Bedford Hospital, they might be able to advise you as well. Sorry, I can't be more help there. Rachel, would you like to come in?
Hello. Yes, it's been very informative, this webinar. I'm the person who wrote that I've recently qualified, and it's good to hear that I'm not the only one stuck in this boat, because I completely agree. I'm going to just say it outright. I started in 2021 and I was sold the dream of do nursing. It's great, which I do agree it is. That's why I wanted to go into the profession, of course. But they said, you're guaranteed a job. I had a placement. They said, when you finish, it was for my final, my sign off. They said, when you finish, we've got a job for you. You're perfect for us. And then all of a sudden, contracts are stopped because, you know, the economy's gone bad. And I thought, oh, my job that I had lined up, that's not a thing anymore. Started looking on Indeed and Tracked and government websites. There's like, no, we want a nurse with experience. And you know, I'm tearing my hair out because I'm like, oh, I've just you know, graduated. How can I get experience if you won't hire me?
Yeah, Rachel, thanks so much for coming in and being so honest. Really appreciate that, because and it sounds like a really difficult situation, but I think like I'm going to let Sue come in here. Yes, Sue, please.
Thanks, Rachel, for sharing your experiences, and just wanted to recognise what a difficult time it is for you. At the beginning of the chat, and I'll put it in after our conversation now, we have a generic nursing and midwifery inbox where we can make contact with you and support you in opportunities around looking for a job. So please reach out to us and I can arrange a one-to-one with either myself or someone from my team.
Oh, I definitely will. Thank you so much. I feel like sometimes I can only speak for myself, but once you graduate, it's almost like, okay, go and do the thing, but we're not going to tell you how, just do it. And you're kind of just stuck in a limbo. It's like, I've got the degree now, but I'm a nurse without any patients.
I know it's really hard, but do reach out to us. I'll just pop the email address in the chat for you.
Thank you very much.
Thanks, Sue. That's really helpful. Thank you. Is there any other questions relating social care? Yeah, so in terms of getting employment, I've just seen a question from Helen in the chat there around employment in Whitcourse Hospital. We don't have, well, I don't have contacts definitely with them, but I would say contact the hospital themselves, look on their vacancy pages, talk to your practice education facilitators, see if they've got any links there in terms of working there. I'm just reading Annie's Sue, I think it's a question for you. So currently I'm sure we can talk about this, can't we, Sue? I don't know if you want to, you've seen Annie's, yeah.
So Annie, thanks for raising it. But we've been told that no roles at Band 5 and we will stay working as a Band 4. Are you able to offer any support? Yes, if you reach out to us with the email address that I put in the chat, we'll have a conversation with you.
In terms of your email, is that the
nursing and midwifery inbox? There's some things I can't post, unfortunately, in the chat, I noticed. If I just do it again, it's I'll just post it again.
Thanks, Sue. Helen, did you want to come in there?
Yeah, I was just going to, obviously the aim of today is to help you as students explore where maybe we might have been anticipating that role in the NHS, that actually we know that those role availabilities have really reduced. So I guess the aim of today was to help students to maybe explore social care and vacancies that might be within social care as well. It is a little bit more difficult to find out about those vacancies because there isn't a one-stop shop place to go like you would NHS jobs. And as Amanda said, sometimes you will find social care vacancies on there, but not particularly often. It is a little bit of a complex process for social care providers to get their vacancies up on there. But I was looking, so the role that I do now isn't kind of client or patient facing, and I didn't want to lose that kind of clinical competency. I've still got many years in my nursing career, and I didn't want to kind of pigeonhole myself in the role that I'm doing now. So I wanted to keep that clinical competency. So I went and I phoned up my local nursing homes and just went down there and spoke to them and said, you know, I'm looking for bank work. I've got this full-time job, but I'd like to do some odd shifts. Would you be interested? Are you looking for bank roles? And 3 out of the 3 I called all said, can you come in for an interview, Helen? We'd love to speak to you. Because yes, we're looking for kind of bank roles. And they are inevitably, 2 of them are also looking for permanent roles. So it might just be looking in your local community of where you live. And when you walk past that nursing home, just going in and actually speaking to them, like Charlene said, popping into that establishment that's near where you live, or that one that you drive past on your way to when you're getting somewhere. And online job searches tend to be places where you might find career opportunities as well. If you type in registered nurse, it might come up on things like Indeed and places like that, vacancies that are out there. And depending what area you're in within the Eastern region as well. I know Norfolk have something called Norfolk Care Careers. So that's a website and a Facebook page, and you can find all sorts of details on there about additional support to help people to prepare to go for jobs, but also vacancies and things are advertised on there as well. So it's just that there's a couple of different places that you need to go to, but there are nursing jobs out there, and they are. We know we're looking for them. And in social care, you know, I think we are the sort of environment where we really do nurture and support people, because it is difficult to recruit nurses into social care. And actually, if you come in with those really strong values and that willingness to learn, then I'm sure that a provider would kind of snap you up, to be fair. Because I know I would have done when I was a registered manager. I wouldn't have minded supporting that person and really helping them to develop if that's how they kind of came in and they were really eager to learn.
Wonderful. Thank you very much, Helen. So, Sue, please.
Just to add to that, we do have the regional vacancy platform where it has a variety of roles working in social care and private organisations and hospices, etc. Unfortunately, it won't let me put the link in the chat. But if you look on the Healthcare Learner Toolkit app, the link is on there for you to have a look at. I don't know whether, Amanda, you can add the link to the chat. For some reason, it won't let me raise it.
I'll try and do that. I'll have a look, and I think everybody should be able to access the chat after the meeting. So if I do it just afterwards, feel free to. So thank you very much, everybody, for coming along today. Thank you very much for your questions. We have recorded this. I know that some the people who ask the questions at the end, if you're not happy for your questions to be included in the recording, please will you pop that in the chat, or just send me an email. I'll put my email in the chat just to say actually you're not comfortable with that, and so we can edit those out. Otherwise we might well leave them in, because I think, you know, the questions that you're asking are probably questions that other people have got in their heads as well. So I'm sure they'll be useful, but we do respect if you don't want them shared further. Just okay. Thank you very much for your comments. I think I'm going to close the meeting there because we're just about coming up for 2 o'clock. But thank you very much to my colleagues, Sue, Helen, Charlene, for contributing and supporting us with the conversations today. So thank you very much.